An interesting case study, a combination of 3 miasms: psora, sycosis, and syphilis. Mr. B, aged 31, lost his character too early in life in the company of some young friends. The dissipation continued unabated for 4 or 5 years. The death of the father, which took place when he was very young, enabled him to inherit a big Ghonerrhea and as big an amount of hard cash. Thus, there was no difficulty in satisfying his vile greeds, no want of money and no check or control in the shape of a guardian. He moved from village to city and surrounded by a number of friends, who only helped him to ruin himself. But dissipation is bound to be soon followed by a reaction, and when his liver had actually reached a condition too frightening to be ignored, he was advised by family doctor to leave off his vile practices and all the attendant objects of enjoyment. The poor fellow was thus in great difficulty. Really, he could neither give off his enjoyments, as they had become indispensable for him by now, nor take to a sober life. He vomited a large quantity of pure blood one morning. He was roused to the reality of the situation. There was the arrogance so long that he had any money, and money would have brought his cure. Still, when the spell of blood vomiting appeared despite all the costly treatment he had undergone, he seemed to be alive to the fact that money was not perhaps sufficient for giving a cure. He had already had gonorrhea and syphilis, but as any long course of suffering from these would have interfered with the pleasures of his life, he got each of these removed by injection the quickest. He used to declare to his physicians that the more quickly they could cure him, the more handsomely would they be rewarded, and it is understood that he had paid 10,000 rupees to a physician in a single day, for having very kindly brought for him a very powerful injection from Germany by a special indent. This powerful injection was said to be so powerful as never to allow the gonorrhea and syphilis in the system ever to make their appearances during the rest of his life. But as ill luck would have it, they made their appearances in all the ugliness of their symptoms, nullifying the assurances of his physician and ignoring the powerfulness of the injection. These will be described later on, but in the meantime, he was so badly suffering from dyspepsia that it grew impossible for him to stay in city. His physicians were unanimous in their opinion and declared that town was to be left at once, and a change for some better place was necessary. He, therefore, went on a change. However, the patient went to his native village for a change on the advice of his physicians, and he went there with dyspepsia which was threatening disaster. Fortunately, the village atmosphere did him some good, and he made up his mind never to go to the city again. His father-in-law, who was a renowned lawyer, advised either herbal or homeopathic treatment just at this stage, and the patient was now in a mood for listening to the advice of his father-in-law and wife. On the father-in-law's advice, a course of herbal treatment was first undergone, but as this failed to do anything, and when the patient actually became bedridden, I was approached, and I made the following record.
I contracted gonorrhea at the age of 21, and syphilis only 5 or 6 months after that. These were removed by injections and external application of ointments of various kinds, but my health broke just here. I had therefore to use all sorts of medicines, including patent medicines from that time. However, at the age of 27, I was quite an old man. When 24 years old, I spat a large quantity of blood one morning. Of course, I grew cautious after this, but as my friends advised me that drinking would cure trouble, I did not give up drinking. It was only after I had become 26, that I gave off wine and woman. It is about 4 years now that I have not taken part in any kind of amusements, and the reason is the condition of my health. I have continuous vertigo, and there is a tendency for falling while walking. It is only by extreme carefulness that I avoid an actual fall. Then again, there is an indescribable pain within the head. At times, it seems, there are innumerable ants within and I feel their bites. This is generally more severe after sleep. I get angry very easily, and any contradiction from anybody excites an irresistible impulse for beating him, as I cannot tolerate that there should be any contradiction to my views. It has become a habit for me to use offhand rough words against all, and at times I abuse my wife and the servants for nothing. But, again, there is repentance and even actual weeping, as soon as I become a bit sober after the angry fit. I then seem to think that all will combine and curse me for having abused them. There is a pain in the back and waist, and this is comparatively severer at night in the bed. There is a tendency for frequent urination, and after a flow, which is always scanty, there is a severe burning pain in the urinary canal. No sleep at night. I feel miserable. Towards the morning, there is a rumbling in the abdomen and it is then followed by 8 or 10 loose motions. It gradually becomes thinner and thinner every time, and the last motion is as thin as water. The rumbling is awfully severe, and it really frightens me. There is perspiration even on very slight exertion. It is fetid smelling, and the smell is garlicky. The evacuation is also the same smell. There is a craving for food, but absolutely no power of digestion. I have often seen undigested solid food being passed with the watery evacuations. There is burning in the hands and feet and on the vertex. Cannot tolerate cold. I prefer the open air but cannot tolerate cold air. Cold air brings on headaches and fever. I am worst in the rainy season, as then I get an accumulation of catarrh in the chest and nose, and this compels asthmatic breathing throughout the whole rainy season. This asthmatic breathing is most severe at the night. I have to sit up in bed and cough and breathe like that during the whole night. My eyesight is bad, and I seem to look through the mist, and various colors seem to be floating before my eyes. I have piles too, and these are also aggravated during the rains and winter. There is a severe cutting pain in the rectum, and also a profuse flow of blood. The most severe troubles at present are the urine and the stomach. In summer, there is a ringworm-like eruption on the abdomen and in the margin of the anus. These exude a highly fetid smelling, thick and sticky discharge. The smell is exactly like that of putrid flesh. There is itching, and itching is followed by pain.
I stopped him just here and said, a thorough cure of all your troubles is possible only by bringing back the suppressed gonorrhea and syphilis. But in the present condition of your health, such constitutional treatment is impossible, as you do not have the vitality to stand the action of deep-acting remedies. For the present, you require immediate relief from dyspepsia. When you have been relieved of the troubles in the stomach, and when you have recouped your health to a certain extent by careful regulation of diet and movements, etc., it will be possible to treat you for a thorough cure. Such treatment for a thorough cure will, however, be necessary, as otherwise, you will never keep well in your life, even for 2 days at a stretch, if the stomach only is corrected. Please, therefore, let me know what else you have about the stomach troubles.
If an all-around cure of my case is possible, by bringing back the gonorrhea and syphilis, and if disease is cured can it all be brought back by medicines, I have no objection. But pray, save me from this dyspepsia first of all.
I then took up the dyspepsia and cured it in 15 or 16 days' time with Thuja 30 and 200, and then sulfur 30 and 200. He was then kept on strict dietetic control for full 3 months, and when he gained some strength, I explained to him the mystery of chronic treatment and cure, and began his case on the 14th of June.
All the symptoms, except dyspepsia and mental prostration, are still there. And I have the following troubles besides. There is a sudden palpitation at times. There is rheumatism also at times. In cold weather and during rains, there is soreness in the body. Memory is gone. Cannot remember things even a month or 2 old. Pray, do something to save me from the asthmatic troubles that will be coming on during the next rains.
After a thorough study of the case, I prescribed Medirinum and gave the first dose of it in the 1000th potency with instructions for reporting results after a fortnight. A sufficient placebo was also given for daily use. After 15 days no gonorrheal discharge yet, but there was a running of the nose. Medirinum 1000, another dose, and placebo. After 7 days the gonorrhea reappeared, and the patient said that it was exactly as it was at the first time, but the prospect of a cure had put courage in his mind. Placebo, twice daily. After 20 days the discharge was almost disappearing. Another dose of Medirinum 1000. After 10 days the discharge was reappearing again, but it was not so profuse. 12 days later the discharge had almost ceased. Medirinum 10 m, 1 dose, and placebo. After a month, no further reappearance of gonorrhea after the 10 m potency, but instead, there came on a severe fit of asthma. It was most severe from 9 or 10 in the night till about daybreak. Natrum sulf 200, 1 dose every morning until asthma abated. And the asthma was appreciably less after 5 or 6 days. Asthma again as is severe as the last time. Natrum sulf 500, 1 dose only. Asthma became very severe in the next 2 days, and after that, it gradually disappeared, and instead, there came out now eczema on the whole body except the face and chest. It was an awful sight to see. The whole body was covered with eczema and a putrid-smelling discharge was rolling down in abundance, and the patient was itching here and there. Syrinum CM, 1 dose every morning for 3 days, and then globule number 10 twice daily. After 4 months, eczema which was drying up increased again. Syrinum MM. 1 dose only. The eczema was gone, and the patient was much improved in the mind too. Gave some placebo, as there were no symptoms practically, to prescribe the next dose, though syphilis was still hidden in the system. The patient was feeling alright, and the few signs of fetid night sweats and vertigo, etc., that were persisting, were not enough to risk a prescription. I, therefore, waited on, in the expectation that syphilis must come out before long in all its symptoms. 3 months later some ulceration in the mucous membrane of the nose came out. This gradually increased. There was pain in the left nostril and some discharge of blood and pus, but as these few symptoms, besides the night sweat and vertigo, etc. were not enough, I decided to wait for another fortnight, and gave some placebo for this period. After a month the ulceration was quite characteristic now, and I gave Kali bichrome, -200 in graduated doses. There was a relief after a week. The ulceration was almost gone. Placebo for a fortnight. After 45 days Kali bichrome 1000, 1 dose, and placebo for a month. The ulceration in the nose was gone, but the nose was running, and it seemed there were repeated attacks of cold. Merck Sol 10 mg, 1 dose only. But, though I waited for full 3 months, the syphilitic chancre did not come out. And as the patient began to show want interest and inclination to continue the course of treatment further, I had to close the case with a dose of tuberculinum 1000, as called for by the frequent tendency to catch a cold. SMB Clinic, partners of your health. Thanks for watching. Do like, share, and subscribe to our channel.